स्ट्रेस क्या है?
रिलेशन
देयर मोर स्ट्रेस इन मेन और वुमेन?
मैन। मेरे पास छोटे छोटे बच्चे आते हैं, नेक पकड़ के 3 साल की गर्ल, नेक स्टिफनेस।
30-40,000 पेशेंट्स को आप देख चुके हैं. What is the most common problem?
सर्जरी सी सेक्शन से हुआ इसलिए कमर में दर्द आता है.
Loneliness causes that stress.
I got many male patients who have cried. I don't work only from brain. I work with my heart.
So in our series of health-related podcasts, one of the common things that has come out again and again is pain. हम सबको कभी ना कभी कोई ना कोई बॉडी में पेन होती है. बैक पेन इज वेरी कॉमन, जोड़ों में दर्द बड़ी कॉमन है और मोस्टली उसका कॉज बताया जाता है आपका बैड पोस्चर, कोई बॉडी का इशू, राइट? हम कुछ ना कुछ गलत कर रहे हैं, पर कोई हमें ये नहीं बताता कि पेन का रिलेशनशिप माइंड के साथ भी है. टुडे वी हैव समबडी इन द स्टूडियो हु इज ट्रीटिंग पेन from multiple angles and has found out that one of the most common reasons of pain is the mind. So thank you, Dr. Richa, to join us in the studio. It's such a pleasure to speak with you. So you are a chiropractor, osteopath and a physiotherapist.
Yes.
So you play 3 roles.
Yeah.
Right? You're a chiropractor, osteopath and physiotherapist.
Yes.
तो ये तीनों चीजें जो है मैंने सुनी है, but इनमें डिफरेंस क्या है?
Thank you so much for your invitation and it's pleasure sitting with you. Difference बहुत ज़्यादा है. Physiotherapy is only about treating pains of joints or paralysis with machines and rehabilitation.
Right.
But chiropractic is something with alignment. जैसे हमारी कार की अलाइनमेंट खराब हो जाती है तो उसमें गड़गड़ गड़गड़ आवाज आती है, वैसे ही अगर हमारी बॉडी की अलाइनमेंट खराब हो जाएगी तो द जॉइंट्स गेट पेनफुल, मसल्स गेट अफेक्टेड. सो अकॉर्डिंग टू chiropractors we have to have a good alignment of the body so that if, like for an example, if your ankle joint, your foot is misaligned, you may get pain in the neck as well because our body is like a chain. अगर एक चेन को हम घुमाते हैं, it will turn till the end. So if our foot is misaligned, our knee will be affected, our hip will be affected, our whole spine may get affected, and then the headaches may comes. So we have to take care of the foot very well. That's why to every patient I tell them that you should wear a good shoe, and we hardly give concern to it. We usually use fashionable shoes, bellies, heels. So
what is a good shoe?
Good shoe is non-heels, and secondly, it should be fit as per your curvature of your foot. It has to be customized.
Okay.
If you have a higher arch, you should support that high arch with an insole. If you have a flat feet, again you need an insole so that you can get an arch and the other muscles and joints get less load over the body.
Got it.
So this is all about chiropractic.
Okay.
And then I come up to the osteopathy part. So osteopathy is something magical, I should say, which I am giving to my patients. We are treating musculoskeletal conditions like pains in your back, in frozen shoulders, and by treating your visceras. Visceras are internal part of your body, internal organs of your body.
Okay.
Like I lift the liver and your frozen shoulder gets better.
Oh.
Yes. I treat your intestines, I treat your ovaries as well. We work on the fascia of those organs and we get the pain relief in the back.
Wow.
And as well, we treat the brain. We treat brain, we say in osteopathy that everything has a rhythm. Like our heart beats, same way every part of the body that beats. So we have to make sure that that beat is synchronized with how much rhythm they should actually have.
Wow. So you have seen thousands of patients in the last 14 years. आपने 14 साल से प्रैक्टिस कर रहे हैं. आपकी दिल्ली में 2 क्लिनिक्स हैं और 30-40,000 पेशेंट्स को आप देख चुके हैं. What is the most common problem? क्या प्रॉब्लम लेकर आते हैं लोग आपके पास?
See, अभी तो सबसे ज़्यादा spine is the most prevalent area of pain, and the irony of I should tell you that what is the irony. Before, for physiotherapy, we used to have age group of 60 plus patients.
Right.
But now the youngsters are more coming to the clinic rather than the old people.
So backaches are happening at younger age.
Neck aches, neck pains, they have been increased from more than 50%. More than 50%.
How young? किस एज के लोग आ रहे हैं?
18 plus.
Wow.
18 plus. Office goings are coming just because.
तो 18, 19, 20 में लोगों को बैकएक हो रही है?
100%.
तो क्यों हो रही है? Bad posture, weight?
Definitely their lifestyle, the way they are sitting in their offices for studies or every time on the laptop or mobile usage. So because of that, and the food habit, definitely it is again hindering them.
Right.
And the stress level.
Right.
छोटे छोटे बच्चों को स्ट्रेस है. इवन मेरे पास छोटे छोटे बच्चे आते हैं नेक पकड़ के. 3 साल की गर्ल with neck stiffness. She woke up in the morning.
3 साल की?
3 साल की. She woke up in the morning and she got like this, and her mom got her to the clinic. And I asked what had happened. Yeah, yesterday she was more on mobile and that's it. So I was like blown from my mind. Ki, what's this? What is this? Right. This is our future.
Okay, so you are saying age 60 से 18 तक आ गई है?
बिल्कुल आ गई है.
यंगर लोगों को प्रॉब्लम्स होनी शुरू हो गई हैं. और largely it is a lifestyle problem.
Lifestyle and the posture, what they are taking while sitting in the office, and they have long hours laptop work. And if I'll tell you how they sit like this, that like slanting down, then shifting their body towards one side this ways, or every time like this. So these all postures are really bad for them, which they have to take care. Otherwise, this is really a problem for them. Even youngsters, when they come to me, 25 plus or 30 plus, they ask me, I need a halt for 1 month. So one day I had in my mind, what, Richa? See how the company is getting affected because they are getting pains. They are taking leaves for a month and they are not getting affected. At the end of the day, company gets affected. So this is really a harm to our society as well. They are unable to sleep because of pains. So this is again, if they sleep good, they will feel good and less pain.
Right.
So yes.
So that's lifestyle. Now, when we were researching about you and finding out about you, we realized that a lot of patients believe in you because you are considered to be a person who can heal and you are different. So what is that difference? What is it that you can do which the others are not able to do?
See,
ऐसा क्या connection है?
I don't work only from brain. I work with my heart.
Okay.
If the patient comes with the pain, I just don't treat the pain of the patient. I treat the cause of that pain. So I ask the history. Maybe the pain is arriving because of something happened in his life or professional life or physical life or family life. Some stress, something happened with them. Because of that, the pain comes. So if he or she has a backache, so yes, I'll be treating the back, but definitely I'll be working on the higher center because the pain is not because of anything rather than the stress.
When you say the higher center, what do you mean?
Higher center is the brain.
Okay.
Because everything is there only.
Okay.
So I have to relax it with the osteopathy, which I do. I relax their minds. I give stress relief to patients. I have patients, those who were admitted because of anxiety attacks. And I can vouch for it that till date she is too good, and after that she hasn't been for any admission in the hospital. So
आप कह रहे हो अगर मेरे बैक में पेन है,
yeah,
the cause could be my mind.
Your stress.
My stress.
Your stress. Not your mind, but the stress which you have in your mind. Yeah.
Right. So stress can give me a backache, knee pain.
Absolutely.
Wow.
What happens? We have some energies which get obstructed in our body. So we, with our hand only, we see the energy obstructions on the body where it is obstructed. Then we do the osteopathic treatments to that patient.
Wow.
and definitely we release the fascia. We work with machines as well. Being a physiotherapist and a chiropractor, I align the spine and align whole body. Then I work on the muscles.
Wow, wow. So, stress, physical pain, and then it is related to everything in life, career, relationships,
Yes, yes, yes.
right?
It is. It is.
So when patients come to you, do they come for a session or do they come for multiple sessions or?
Yes, they do come for the multiple sessions, and according to my treatment, I don't call them daily. I just call them on alternate days, or once in a week, or twice in a week, or a fortnight, because our body has a self-healing process. So
Okay.
I give time to that self-healing for the body to get healed.
Okay.
And we do dry needling. So when we do dry needling, we are increasing the blood flow inside the body. So
What is dry needling?
Dry needling is something we do with the needle.
Okay.
We break the trigger points, muscular trigger points with that. Or if I'm doing something active, if the muscle is shut down, the muscle is not working. So I need to activate that muscle first.
Okay.
So with the dry needle, I activate the muscle and then.
So needle अंदर डालते हैं.
Yes,
Okay.
we treat with the needle,
Okay.
pricking it inside. They are very, very fine needles. They don't harm anything, and we use sterilized, not the sterilized, but the new needles.
Okay.
Yeah,
So a lot of people who are doing desk job,
yeah.
you know, the most common that I hear of back problems and health problems is corporate people जो सारा दिन desk पे बैठ के काम करते हैं. Is there any advice for them about their posture?
100%.
Okay.
Their table should be of the height which is opt for them. The mouse, even the mouse where they are placed, where they place, that again helps them to reduce their pain in the wrist. They get carpal tunnel syndrome because of the mobile use, because of the laptop, this mouse usage.
Right.
Because every time they are in this position, and the median nerve get compressed over the wrist.
Okay.
So we usually tell them what and how they should use their mouse, and how they should keep their hands, what should be the height of the table, what should be the height of their laptop, what kind of chair they should sit on. So these all the things really play a very important role if any software engineer or the people who are on the desk work.
Right.
So these really plays a very important role.
Right. Okay. So as a chiropractor,
yeah,
what is the efficacy or efficiency or outcome of chiropractor? आजकल इंटरनेट पे बहुत ज़्यादा आता है कि you know ये इस सब से कुछ फर्क नहीं पड़ता है, ये scam है, and so what do you have to say about that?
See, it is a controversial thing though. Chiropractic should be done by the certified chiropractor, not by any quack.
Okay.
केवल एक pop निकाल देने से the person is not a chiropractor. Chiropractic is very precise. If I want any kind of alignment at L4, L5 level in the lumbar, kamar mein, so I have to place my hand, the vector should be at that level, that the popping and the alignment will be done at that level only, not the other levels. So it has to be very precise. So that's why like people, everyone is popping the joints. So that's why it is becoming bit negative, because everyone is popping the joints.
Got it.
And I got many patients because of the wrong practice. They got their pains aggravated. And even I got one patient, he went to someone, I will not take the name. He went for the shoulder pain, and he came to me from Faridabad to East Delhi for his back pain, and that severe that guy, 18 years old boy, he was unable to sit.
My God.
And he just went to a so-called chiropractor for the shoulder pain.
Right.
You understand? So it has to be very precise, and it has to be done by the practitioner who is certified rather than anyone.
Right. So there are a lot of quacks out there.
Yeah.
So how do I as a patient, how do I find out कि ये quack है, ये ठीक नहीं है, ये ठीक है, ये खराब है?
You need to ask, you have to see their certificates if they have some certification done from any good university or somewhere, and not the 2 days workshop or a 1 day workshop. That doesn't help anyone.
See, as a layman, when I
Yeah.
go to a doctor's clinic,
Yeah.
तो वहां पर कुछ फ्रेम करके कुछ चीजें लगी होती हैं.
Mm-hmm.
अब वो कितनी वैलिड हैं, कितनी वैलिड नहीं है, इज इट अ गुड सर्टिफिकेशन, 2 day वर्कशॉप है, 3 day वर्कशॉप
Yes,
है.
I understand that.
So how do I?
We should go with the reviews of the patients on the Google maybe.
Okay.
And maybe YouTube will help. Google can help them out in it.
So one is look at the certificates.
Yes, yes.
And the certificates should not be a 2 day, 3 day workshop, but it
Yes.
should be a degree or
Absolutely.
right. That's
absolutely.
one thing. The
Yes.
second is कि Google पे आप reviews देख लो.
Otherwise, yeah, chiropractic definitely it works. Just want to share one of the incident. What happened? One day I got a knee pain.
Okay.
2 days I took a treatment.
मतलब आपको
from
भी
my-
knee pain होती है?
हो जाती है sir. Because I maybe because of some exertion or some stress.
Sure.
So I took treatment, 2 day treatment, but it didn't help me. Just a machine. I applied some machine.
अच्छा खुद ही किया आपने?
It didn't help me. Then the third day I said, "Oh, Richa, why don't you align yourself?" I took my adjuster, that chiropractic tool, and I clicked it, and I was like wondering ki only this will, if it will help me out. And after 15 minutes, my pain was gone, literally gone. And I was like, wow. So that's the power of chiropractic. So I'll not say that it doesn't help. It definitely helps if it is done in the right manner, right way, right person, and right joint.
Right, right. The other is that, you know, in India, again, as a layman, I know physiotherapy.
Yes.
Right? I know कि आपको कहीं पेन हो तो फिजियोथेरेपिस्ट के पास चले जाओ, कुछ एक्सरसाइज करेंगे, कुछ मशीन लगाएंगे और कुछ फायदा होगा. बट ऑस्टियोपैथी
Yes.
और कायरोप्रैक्टर के बारे में नॉलेज कम है. एंड मे बी दैट्स व्हाई क्वैक्स कम अप, एंड बिकॉज नॉलेज नहीं होती तो कोई बोलता है कि चले जाओ, तो आप कायरोप्रैक्टर कहीं बोर्ड पढ़ा आप चले गए. तो इज देयर अवेयरनेस ग्रोइंग? आप तो इस इंडस्ट्री में काफी देर से हैं. इज देयर अवेयरनेस ग्रोइंग? इज देयर अवेयरनेस एंड नॉलेज ग्रोइंग इन पीपल के किस काम के लिए किसके पास जाना चाहिए?
सी कायरोप्रैक्टिस की अवेयरनेस हो रही है, बढ़ रही है, लेकिन इस वक्त बहुत ज्यादा क्वैकरी चल रही है. बट यस, ऑस्टियोपैथी के लिए अभी people don't know about osteopathy. And again, the wonderful thing is that osteopathy is a Vedic science which has been originated from India.
Wow.
And from USA. People are practicing in Australia, Europe. They are practicing more than India. Indians don't know about osteopathy.
Wow.
And it is originated from India. So this is again an irony. We should respect our science, which has been originated from here.
Right, right. Okay.
So maybe within few years, it will be more prevalent in India as well.
Right, right. And so, to avoid these problems,
yeah.
एक तो हो गया कि प्रॉब्लम हो गई, फिर तो लोग आपके पास, you know, they go to somebody who can help them. But precaution is better than care, 100%. Right? So you should try to avoid कि मेरे को प्रॉब्लम हो ही ना. उसके लिए आपका एडवाइस है, एक तो पोस्चर, दूसरा लाइफस्टाइल,
yes.
तीसरा which is something which is perhaps not in people's control is stress.
Yes.
अब स्ट्रेस तो मेरे कंट्रोल में नहीं है, वो तो मतलब आ गया तो आ गया, क्या कर सकते हैं? Though we should talk about it. Fourth, my question is, does diet also affect it?
Diet, yes, it affects to a certain extent, because like vegetarians, they do have neural pains, or they get their nerves weak more because they are on vegetarian diet, and it has less vitamin B12.
Okay.
If I compare to the non-vegetarians.
Okay.
So we should have eggs in our diet, so that the vitamin B12, which is very, very important for our nerves, has to be taken. Or eggs, we recommend our patient to have eggs if they can. And I'm missing one thing, the muscle exercises. Exercises are very, very important. People are every time working on laptops. Whole day they are working.
Right.
But they don't give time, half an hour, just 30 minutes to their body for exercise, which is very important.
Okay.
And that could be a very, very, very important reason for the pain.
Okay.
So that is again one of the reasons. Like a woman, if I tell you, a woman who has delivered babies, maybe C-section. So they get a cut of that area.
Sure.
So when something gets cut, that area becomes weaker.
Of course.
Am I right?
Yeah.
If I cut your shirt and I then give a stitch and then again I pull you, which is the weaker part of that shirt?
Yeah, the one that has been stitched.
Absolutely. So the one which has been stitched has to be strengthened. Otherwise, that will be a cause for the back pain. आपने सुना होगा पेशेंट्स को, लोगों को बोलते हुए, फीमेल्स को, कि सर्जरी सी सेक्शन से हुआ है इसलिए कमर में दर्द आ रहा है, इसलिए कमर में दर्द आ रहा है, वो इंजेक्शन जो लगा है उससे दर्द आ रहा है. इट इज नॉट द इंजेक्शन विच इज bothering her. It is the core muscle which is weak, which is bothering her. So we have to work on core strength. Not only for females, it is for males as well. They are every time sitting. They are not doing any exercise. So they have to strengthen their core, their spine, their leg muscles, their buttock muscles. So everything is important if they want to be fitter.
Right.
And more successful as well.
Okay, so those are 4-5 things that people should do.
Yes.
Are there exercises that you recommend to your patients? Are they simple? Are they...
See, doing exercise is easy, but doing correct exercise is difficult.
Okay. तो क्या करना चाहिए? मतलब, do you conduct classes? I mean...
Yes, when I treat patient, the exercise regimen is under the treatment
you
itself.
teach them.
So, not only teach them, but I make them do there.
Okay.
And we stand and see if they are doing right. That's why I told you, doing exercise is easy, but doing right exercise is difficult.
और थोड़ी सी गलत हो गई तो you can harm yourself.
You may harm or you may not harm, but you will not get the impact.
Got it.
You understand?
Got it.
If you want to contract that muscle and you are not contracting that muscle, rather the other muscles are working, so I'm not getting the impact. So doing exercise is easy, but doing the correct exercise is difficult. You got?
And my question
so that makes me different from other physios or chiros or osteopaths.
Right. Okay. And my question about diet.
Yeah.
So you're largely saying that eat a healthy diet.
Yes.
Eat eggs or non-veg or whatever which can strengthen your...
Or if you are vegetarian, you add chia seeds or any kind of whatever is required for you, like spinach.
But a balanced, nutritious diet will help.
You have
will help.
Yes.
And what about, and that's the complicated one, and that's the one which perhaps is unique about you, where you are saying that pain has a connection with stress on your mind, right? Is there a solution to that?
Yes, absolutely.
अब हम सबको जिंदगी तो जीनी है.
Absolutely.
Stress तो मेरी life का part है.
Absolutely.
Right? तो उसके लिए मैं कुछ नहीं कर सकता या कुछ कर सकता हूँ.
बिल्कुल कर सकते हैं.
क्या कर सकते हैं?
Meditation. If you will ask me, if what you can do, you can meditate yourself. You do exercises.
Okay.
This is two parts which can relax your brain and body, because some hormones are released which are happy hormones, because of which your stress releases and you feel good, right? So this part can be done by you. If you cannot meditate, patients say, I cannot meditate. So for that we are here. So I treat with osteopathy, with CST, if you have heard, craniosacral therapy, which I give to my patient. I relax their brains. Sleep disorders, my patient sleeps there itself for an hour.
Wow.
And they say that मैं तो नींद ही नहीं आती है मुझे. And when they sleep and I make their videos, they are astonished. Really, I was sleeping? Really?
Wow.
So this is a win situation for me as well as for my patient.
Yeah, you seem to be really proud of it. Yeah, absolutely. But let's say आपके पास patient आया जो बहुत stressed है, right? Do they share with you that we are stressed, or you have to guess it?
See, it's all about the confidence of my patient on me. If that patient is confident on me in the very first session, he will share everything with me with the tears in their eyes. And when they have that confidence, तो मैं उनको मीठी गोलियां भी खिलाऊंगी तो भी ठीक हो जाते हैं patient. So, because people right now, they don't have anyone to hear them. Mainly the old age group, they want someone to hear. So they sit, they tell me their stories, they feel good, then I go with them for the treatment, and they definitely, they feel good.
Wow.
So, and else, if the patient is new and they have some discomfort or hichkichahat, when I give treatment, I relax their brains and all, they get confidence. And maybe in the next session or after 2-3 sessions, they open up and they tell their stories. And when they tell everything is here, and they get better.
So you're saying a lot of senior citizens, or maybe even not so senior citizens, loneliness causes that stress, right? And so loneliness,
maybe relationships, maybe loneliness. There are many reasons. Maybe the boss could be the reason.
Right. Mind is a complicated thing.
Mind is a complicated thing.
And then mind is controlling our body.
100%.
Right.
It obstructs the energy flow. Our emotion gets obstructed. If maybe I'm having some stress, my energy flow may get obstructed in any of the part of my stomach. And it may, in later case, it may affect that area. Or it may go to my joints. My joint get affected.
To senior citizens with, let's say, loneliness issue, or a 40-year-old with a relationship issue, or a 35-year-old with a career issue with a boss,
yes.
Do they share it with you? How do you know this? Open up kar jate hain?
They open.
They trust you, they have confidence.
That trust is only with the skill. Like when they get better with my treatment, that trust, that confidence automatically comes to me. And then they share.
And does that help you to treat them?
100%. I treat them accordingly. If that patient is too much stressed, too much sensitive, then I have to be very cautious with that patient. Otherwise, every patient is different. Every patient is different and every pains are different. So, I treat every patient as a different patient, and the treatment is again customized as per the requirement of that patient. Not like for any backaches, there is some regime which I am giving to that each and every patient. It's not like that. Whenever they come, in every session, I assess them again. And the treatment changes according what prognosis, what result they are getting to me. So this is again a very good thing that not the same treatments which I have written that is carry forward for few sessions. It's not like that.
So जब patient आता है अपनी pain की problem लेकर, it is not just कि वो आके बताता है कि मेरे को यहाँ पर pain हो रही है. If he is able to tell you कि मेरी life में क्या हो रहा है, it helps you treat him better. The more he opens up.
See, in the starting, if for an example, a new patient comes to me, he will never say कि मेरी life में क्या हो रहा है. He know about the pain. So, I have to treat his pain. Then, while assessing him, I ask few questions which give me the idea that what he is going through with. And then I treat him. Then later on I tell, is this an issue? Something happened? This. And then he says, yes. So that, then the confidence and that relationship with my patient develops.
So you have a trick to get that answer out.
Absolutely. See, patient never tell you directly that I'm suffering from this because of something happened. They know their pains. They just know their pains. If they have headache, they don't know why the headache is.
But my point was that the advice for people watching this, or advice for somebody who's got a pain, is कि जब आपके पास वो जाए या जिसके भी पास जा रहा है, he has to understand that this is not just physical. There is another level which is impacting my pain. There is a stress, there is something happening in my mind which is impacting my pain. And second, कि मैं जिसके पास help के लिए जा रहा हूँ, the more open I am, the more I share about my problem, the more I am enabling that person to help me.
Absolutely. One thing to share, why I said stress increases pain. When you are stressed, we have automatically our muscles get squeezed out, that contracts, the tightness develops. So if I see that I have a stress Maximally patient comes with the neck pain or headaches. Why? Because their neck muscles get tighter and they get spasm in their neck and they get pains. So only treating this area, definitely I'll be treating the muscle spasm for sure. I'll be aligning his spine for sure. And we'll be giving some exercises, strengthening exercises for the neck muscles. Along with that, I'll be treating the main center, his head, and relax, calm him from the stress.
How does that happen? How do you take stress away from somebody?
You take the session, you'll get to know.
Okay. All right. I will perhaps come for a session.
It's just a very light touch therapy. And what patient says, they go to some next level of world and they sleep and they get relaxed. And many a times their emotions comes out after the treatment. They cry.
Oh.
I got many male patients who have cried in front of me after the treatment. And after crying, they become lighter. And when they become lighter, their pains
release. Okay. So after all your 14 years of experience, do you feel there is more stress, and this is a difficult question, but is there more stress in men or women?
Men.
Yeah?
Yes. Mere clinic mein, if 40 patients are coming, then 70 to 80% patients are men.
Okay.
Because of their work.
क्या stress है? Work stress है mostly?
Work stress, life stress, for sure, relationship stress. They don't have time for their family, and because of the work. But at one time, they need love also. But what happens, I'm going thoda sa different जा रही हूँ topic से.
No problem.
But at the end of the day, they want love as well.
Of course.
But they don't get from their family. The stress doubles them up. So, and this today's life, people are rushing towards money.
Right.
And the patients, those who are having more money, they are more stressed.
Oh.
Less money, less stress. More money, more stress.
Wow. Why is that? More money should bring more comfort, more luxury, more...
Yes, they have luxury, but...
So stress क्या है?
Relation.
Okay.
Just to earn money, they leave everything.
Right.
And when they have everything, they don't have anything.
Wow. Wow, that's very well said. Very well said. So that causes the stress. So they were running to make money.
Yeah.
But in that race, they lost their relationship.
Yes.
And now they have the money, but जिसके लिए कमाया था वही नहीं है.
Absolutely.
Wow. That's and that then causes the pain and...
Yes, 100%.
तो उसका solution तो कुछ नहीं है लेकिन.
Solution हम है ना.
Right. And do these kind of people keep coming, or
they do.
After some time they're able to take care of their...
They come when they become regular patients, when they get much better, like 90% better. They usually comes once in a month for the review, so that the exercises which I have told them, they are doing or not. So it's like a class for them कि हाँ अब मुझे जाना है वहाँ पे डॉक्टर रिचा पूछेंगी और नहीं की होगी तो डांट पड़ेगी. Because I am a very strict doctor. मैं कहती हूँ ब्रो अगर exercise नहीं करी है तो मेरे पास मत आना.
Oh.
So I'm that strict. So they have in their mind कि नहीं जाना है, and we have regular follow-ups from my reception. So my patients, they are very cooperate with me, and when they will get the result, they will get those facilities which they are seeking, so definitely they turn up.
Right.
And moreover, now people are aware of their body,
right. So
their fitness.
So I like to run.
Yeah,
I'm a runner who runs quite regularly, and so kabhi I have physical, कोई niggles, कोई back pain, कोई knee pain, कुछ हो जाता है. So normally I've been to a physiotherapist, and in my running community, everybody almost knows a physiotherapist. I've never come across somebody like you who's doing physiotherapy, osteopathy, and chiropractor at the same time, and who's treating it so holistically, who's trying to say, "Acha, aapke mind mein stress and all that is happening." Are you one of the only ones, one of the very few? Are there many people like you in Delhi, in India, in Bangalore? Do you get people only from Delhi? Tell me more about this space.
Yes, we have physios, chiros, and osteopaths in India, but they are less, maybe in hundreds. And we are hoping that it will increase. We are definitely going to increase them because it is serving the society. And if I'm not wrong, you were asking about the patients coming from outside.
Right.
Yeah, definitely. I'm getting patients from Mumbai. I get patients from Pune as well. I got the patient, and Haridwar people.
They come to you to
Yes,
Delhi
yes,
to.
yes. They stay nearby my place and they come for the treatment. Actually, right assessment. If the assessment is right, your treatment will be right. I'll just give you an example. One of the patients from Haridwar came just for an assessment, and he was a young guy. He got married 2 months back, and he got some accident from his bike, and he came with the pain in the legs, and he was like, "Ma'am, मेरा MRI है ये spine का, मेरी तो disc बाहर आ गई है और मुझे तो surgery बोला है." When I saw when I assessed him, I said, "Dear, I cannot say that this is a disc pain. I think your hip is affected." And he was like, "Are you serious? I have shown to many doctors and they are like कि disc का है." मैंने कहा एक बार MRI या एक बार hip का X-ray करवा लो आप. Treated that day for his hip only.
Okay.
He went back to Haridwar. He had been for X-ray MRI. He called me, "Ma'am, you were right. I'm having grade 2 AVN. AVN is avascular necrosis." When I was like, "I told you." Then that confidence developed and he came to Delhi. He stayed nearby my clinic for 10 sessions, for 10 days in fact. He came to me and he was unable to sit even for 10 minutes, which he was able to sit now, like for n number of hours. And after third day, he came to me, "Ma'am, I went with my wife for a movie and I was so happy I could sit for 3 hours." So that was the achievement.
Wow.
So I just want to tell that if your assessment is right, your treatment will be right.
Right.
If your assessment is wrong, the patient cannot be treated in a right manner.
Right. But back to my question, the number of people who are doing what you are doing is still very limited in India.
Absolutely.
Right? I mean, you're hoping that it grows and I'm hoping it grows too. We are 1.3, 1.4 billion people. A few hundred can't do it.
Right.
You need maybe thousands. But the reality is कि आज की rate में तो काफी कम है. And that's why you're getting patients from all over the country.
Yes.
Wow, that's brilliant.
Yeah, I've been to Alabama, USA and Thailand, Chiang Mai. I'd been there for my studies.
Oh, okay.
Yeah. And did my diplomat in osteopathy from Steve Sennett from Canada itself.
Okay.
Ontario, yeah.
Okay. So you've got global education and now you're practicing in India, which is great. You never thought about practicing there?
I got an opportunity for Alabama itself when I went there. Dr. Daniel Bishop, he asked me to work there, but I was married, I had a kid. So in Indian families, the girls have some restrictions, so I could not. And it's okay. I'm still proud of myself.
Outstanding. Absolutely. You're doing great work. Yeah. Absolutely. So, last question, hopefully. People will watch this video and they will Google it and they will find some exercises online and all that. Is it safe to try and do it yourself?
No.
Okay.
Not at all. Okay. Not at all. People do, but this is really risky for them to do.
Right. So, they should.
So I should literally say to everyone who are watching me, please don't try to do by your own.
Okay.
Do go to the expert and get yourself treated rather than cracking yourself.
Okay.
And every time cracking is not good as well.
Sure.
Because when you crack yourself, you are stretching your ligaments.
Sure.
And you are increasing the instability of your joints again and again.
Right.
So I don't recommend.
Right. And how do people reach out to you? Is there
People come to me through Google mapping,
Okay.
through doctors, walk-in patients,
Okay.
word of mouth. That is the main source of my patient.
But for an appointment, they call your clinic and take
Absolutely.
an appointment.
They call and
That's
they
the
take
best
the
way of doing
appointment.
it.
Yes.
And you see patients Monday to
Yes.
Saturday,
Monday to
Monday to
Saturday.
Friday,
Sundays we are
and in both the clinics.
in both the clinics.
It's
Vasant Vihar, one in Vasant Vihar and one in Jagriti Enclave, East Delhi.
and you are some days in Vasant Vihar, some days in Jagriti, or
I'm daily in Vasant Vihar, daily in Jagriti. I have divided my timings.
okay, so you travel around.
Because of my patients. I love my patients. I am passionate about my work.
Right, right. Do you also do online sessions?
I
Are they
usually
in
do
person?
to the patients who are abroad, maybe. Yeah, I was treating one of the kid from Switzerland.
Okay,
Yeah, so, and even to the patients who asked me for some chest physiotherapy during COVID, I did. And even now also I get a few of the foreigner patient, NRIs or patients from abroad, they call me and they take online sessions from me.
okay,
But yes, I cannot touch them,
sure.
but I can just observe them and tell them what to do, what not to do, and how to do
Right,
the
right.
things.
So you prefer people come to the clinic,
Yeah, I prefer.
but if they can't because of whatever, then you can do it
Absolutely.
online.
Yes.
Great.
Yeah.
Outstanding. Thank you so much, Dr. Richa.
This is all mine, sir.
It was such a pleasure to speak with you and learn so much.
Thank you.
And I think for people watching, the most important thing I'm taking away, and hopefully you are taking away, is that our body is not just controlled by our body is also controlled by our mind. So,
That's why my clinic's name is Align Body.
align body. Okay, okay. But stress is a big thing,
Yes.
and that's my takeaway.
Yes.
I don't know how to control stress, but if you can't, then Dr. Richa is always there to help us.
Thank
you so much.
Thank you so much.